Good afternoon, everyone. Last lecture we started with new repertory, that is Bowling Hussein's Therapeutic Pocket Book. In that, we discuss about life history of Dr. Bowling Hussein as well as some introductory part of this repertory. Yes, yes. Any query? In last lecture, we discussed about art of physician in taking the case. So, in taking the case, the physician should consider the subjective symptom as well as objective symptom to construct the totality of the case. Then he should convert the symptoms of the patient into rubric. Then modalities are important to unlock the simillimum. Every symptom should be completed in itself, that is location, sensation, modality and concomitant. Then complete the incomplete symptom by theory of analogy. Every symptom that refers to the part may be predicted of the whole man. The symptoms of a remedy is discovered by assembling. It was not taken after proving on one prover, but after assembling under one scheme all the symptoms of many prover. Then genus epidemicus depends on study of many cases for the purpose of observation, which focuses on totality. Symptom of a remedy as observed in proving can be found in any given case. Then disease symptom plus remedy, when we match the disease to the remedy picture, then when we get the similar totality of the disease and remedy, then we get the perfect totality. So what is the wish of Dr. Boning Hussain? That all the world's physician, homeopathic physician, will understand each other and also prescribe with safety one and the same remedy for identical morbid symptoms and not for the identical names of the disease. Then we today start with philosophical background of this repertory. According to Dr. Boning Hussain, he said that repertory is means to end and never an end itself. It is the breach of knowledge between physician and chronic disease or patient. So we should never consider or the repertory is nothing but it is breach between the patient and the physician. So it is said that the repertory is never an it means to an end but never an end in itself. From when we go through any repertory, then from the structure of a repertory, the physician gains the best outlook into the patient's past conditions, present symptomatology, and his probable future development. When we go through the symptoms of the patient, when we go through the case taking, then at that time when we get the past history of the patient, present history of the patient, then with the help of repertory we can predict what may be what may be the future of the patient regarding his health or disease condition. So repertory will helpful to find out the probable future development in the health of the patient. Boning Hussain, he he was follower of Dr. Hahnemann, and he proceeds upon Hahnemann's theory that the man who is sick and all discomforts are the part of his condition. So, not the part, we should never consider the part, we should never consider the organ of the patient. But when we are treating the patient, according to Dr. Hahnemann, we should consider the man as a whole, not his part or not his organ, what is diseased. So Dr. Boni Hussain, he also followed these concepts of Dr. Hahnemann, that the man who is sick and all discomforts are a part of his condition. Human organism is a great complicated machine composed of many parts assembled according to definite plan or idea. As in any machine, when we see any machine, observe any machine, then in any machine there are different parts, it is composed of different parts, and when we organize those parts systematically, when we assemble those parts of the machine systematically, or those parts systematically, then we get the machine. And when these parts are assembled properly, then only it is going to work properly. So our human body, the human organism, is also like a complicated machine as that of any machine. The human organism is also like a complicated machine, and it is composed of many parts which are assembled according to definite plan or idea. There must be a storehouse for the parts. The repertory is nothing but a stockroom or factory. As like in factory or stockroom, all the parts or storage of parts, they are at their they are kept at their own self, and the workmen set these parts to form a machine. Like that only, it is nothing but a storehouse, the storehouse of our body. The body of the human organism is nothing but the storehouse of the part, and in that all the organisms are arranged, assembled properly according to plan, so that it will work properly. If the while doing the machine, any machine, the parts lying loose on the shelves, on the floor, on the workman's bench, and it is not called as a machine, but they are only parts. And these parts, when we arranged, as I said just now, that when we assemble these parts in proper way according to proper plan, and then they give the those parts, they form a machine, and it will give individuality, it will give form, utility, efficacy. The therapeutic pocket book of Dr. Boni Hussain, it furnishes both plan and parts. So in this therapeutic pocket book, it was constructed according to a proper plan. There is proper plan how to construct, there is fixed philosophy, fixed some concepts, how to construct the repertory. And in the book, when we go through this book, or when we go through this repertory BTPB, then we found that it was assembled, it was constructed according to proper definite plan. For example, if a person becomes sick or diseased, then what happened? The inner man of the vital force would become passive and oblique to obey the command of the inimical influence to produce irregular functions of different parts of organism, as a result of which abnormal functions and sensations result. So when the person is healthy, then he then he obey the command of vital force. But exactly opposite will happen when the person was ill. When the person was ill, then he cannot follow the command of the vital force, but he obey the command of the inimical force, inimical influence, and so that it produce irregular functions of different parts of organisms, as a result of which abnormal functions and sensations result. These we considered as signs and symptoms of the patient. When we get such irregular functions, such abnormal functions or symptoms from the patient, sensations from the patient, then it is considered as, or we said it as, a signs and symptoms of the disease. So totality of symptom must be the sole guide in treating the patient in a rational way. So while treating the patient, after taking the case, to form the totality is the most important part before repertorization. So this is the most important part, and without proper totality we cannot go further, find out the exact simillimum. When Dr. Boning Hussain, he go through the symptomatology of the materia medica, he go through different materia medica and symptomatology of different materia medica. Boning Hussain realized many difficulties, and he found that many symptoms which are recorded, which are written, they are incomplete, and very often the incomplete part was relating to their modalities. Most of the time, by taking the case, we cannot get the proper modalities of each and every symptom or related to each and every part. So there, most of the time he found that when he go through the repertory, he found that there is lacuna in finding out the proper modalities. Boning Hussain held that a symptom should be complete so that it fits into the totality, as the proper totality formation is very much important. And as Dr. Boning Hussain, when he go through the symptomatology of different materia medicas, he found that most of the symptoms in materia medica, they are incomplete, and to complete these symptoms, the homeopath, they should focus to complete these symptoms so that they should fit in the totality. And according to Dr. Boning Hussain, complete symptom, which consists of following components, that is location, sensation, modality, and concomitant. So what is location? Location, which include part of the body, which include organ of the body, tissue system, direction, and extension involved in disease process. And what is sensation, or which things came under sensation? That is, change in normal function alters the sensation. When there are changes in the normal function, it alters the sensation, which is first noticed as a complaint. It includes type of pain, suffering, and functional or organic changes characterizing the morbid process. So sensation is, or under sensation we have to consider the all the changes in the normal function which alter the sensation, which is first noticed as complaint by the patient. And under sensation we have to consider the type of pain, type of suffering, as well as functional or organic changes characterizing the morbid process. Then modalities which include factors such as causing, causative factors, exciting factors, or increasing as well as decreasing, or any other modifying factors of the symptom. So modalities, aggravating, ameliorating factors related to that symptom, as well as the factors which excite the condition, which due to which the person changes from health to disease, or the causative factors. These we have to consider under modalities. Then concomitant, its presence would help to individualize the case, because concomitant symptoms, they express, or they are expressions of the individual, and thus deserve prime importance in study of symptom and disease. These are also called as PQRS symptom according to Dr. Hahnemann, and as they express the individuality, they express the expressions of the individual, so they are important in study of symptom and disease. They help to differentiate between case and between remedy, so that also they are very much helpful. And Dr. Boningussen's attempt was to complete the symptom, as he advocated to, or as he advised every homeopath, he should take each and every symptom as a complete symptom. But actually in practically it was difficult to take each and every symptom as a complete symptom, and he himself as well as many homeopaths which are practicing at that time, they faced the same difficulty, that it was difficult to do so. It was difficult to take each and every symptom as a complete symptom. They cannot get the proper each and every symptom as a complete symptom with location, sensation, modality, as well as concomitant. Therefore, he advised, or he introduced the new theory, and he said that what is true to the part is also true to the whole of the person. The following fundamental concepts form the bedrock of his therapeutic pocket book. So as he was follower of Dr. Hahnemann, And according to Dr. Hahnemann, we should not consider the part or the organ, but we should consider the man as a whole. So, according to him, what is true to the part is also true to the whole of the person. Means when we cannot get the modalities, then or concomitant, then we have to consider the one part's modality as a whole person's modality. And from this concept, he introduced new doctrine to the homeopathy, that is doctrine of analogy. And this doctrine of analogy is very much important. It was frequently asked question for short note as well as during oral examinations also. The question on doctrine of analogy, it was asked frequently. So what is doctrine of analogy? Boninghusen's analytical mind came to conclusion that to complete the symptom, the local modalities and sensations pertaining to one part should also be applied to other part. Means when the one part is diseased, or sorry, when the one part is diseased and at the same time the patient is getting some pain or some symptoms from the other system or other place, other part of the body, then in that, when we get, if the patient was suffering from 2 to 3 complaints at the same time, and if we get only modalities of the same part, then we have to consider, to complete the symptom, the local modalities and sensations pertaining to one part should also be applied to the other part. Means, as I told, that what is true to the part is also true to the whole of the person. We follow this concept when we get the some symptoms are incomplete in the case while taking the case. Thus, he raised local symptoms to general level, which could be used for whole person. He considered sickness is an expression of the whole man and not of the part. Sickness is expressed through different parts of the person. Thus, all the modalities which are noticed in one part but missing in any other part should be taken as an expression of the whole person. So this is the concept of doctrine of analogy, that when the patient was suffering from many complaints and only he get, or while taking the case we get only modalities of one part, then according to the concept of Dr. Boninghusen, we have to consider the man as a whole and not his part, not his organ. So we have to consider the modalities of one part as whole person's modalities. However, this approach may not serve those cases wherein different parts express different modalities, which do not correspond with the person's characteristic. If two parts they are giving different type of modalities, then this approach may not serve, and which do not correspond with the person's characteristic. So this is all about doctrine of analogy. Doctrine of analogy is most important concept which was introduced first time by Dr. Boni Hussain to complete the incomplete symptom whatever we get from the patient, and this was the important doctrine of from his philosophical background of this repertoire. Then doctrine of concomitant. So this was again new doctrine which was introduced by Dr. Boni Hussain to homeopathy, that is doctrine of concomitant. What is concomitant symptoms? The symptoms which do not have any direct pathological relation with the main complaint. So Boni Hussain he found a group of symptoms along with main complaint, which in practice were generally overlooked by patient and unnoticed by physician because of inadequate observation. So these concomitant while taking the case, as the patient he doesn't know the importance of that symptom, as well as if the physician he was not find the symptoms, such symptoms, then he should find out is there a symptom which is present with the chief complaint. So this is the important thing to find out, is there any symptom with the chief complaint. Such group of symptoms even appear to be unrelated to the main complaint, but all the same they are quite crucial in individualizing case as well as remedy. So these symptoms we in the case our master Dr. Hahnemann he stated or he said these symptoms previously as a PQRS symptom. He said previously these symptoms as a striking, singular, rare and characteristic symptoms which Dr. Boni Hussain he described as a concomitant symptom. So the concomitant symptom which are to the totality what the condition of aggravation as well as amelioration is to the single symptom. So usually most of the time the concomitant symptoms they are for whole person and not for the any one part as like that of modality. So these symptoms, these PQRS symptom or concomitant symptom, they are very much important to find out the exact symptom as well as to individualize the patient. So find out the homeopathic point of view, these concomitant symptoms, they are most important symptoms. The concomitant symptom is to the these concomitant symptoms, they don't have, as I told, that there is no direct pathological relation between the chief complaint and this symptom, and so the value of these symptoms will get increased. They will help very much to find out the individuality of the patient. So in this way, these symptoms are very much useful and helpful to find out the exact simillimum as well as to individualize the remedy. Individualize the person as well as to individualize the remedy. Then he introduced some other doctrines also to the homeopathy. He introduced the doctrine of grand symptom, doctrine of complete symptom, as well as evaluation of remedy or gradations to remedy. This was also first time introduced by Dr. Boning Hussain, that by constructing the index of the symptom, we have to give values to the remedy according to their importance in that symptom. So, evaluation of remedy, it was also first time this concept was introduced by Dr. Boning Hussain. So, in during constructing this repertory, Dr. Boning Hussain, he advocates, he gives many new doctrines to the homeopathy, many new concepts to the homeopathy in the philosophical background of his repertory, like as just we discussed about doctrine of analogy, then doctrine of concomitant, and the third one is doctrine of grand symptom. So what is grand symptom? The symptom which consists of location, sensation and modality. It's called as grand symptom. The grand symptom, in grand symptom, what is location? Which things which came under location? So under location, as we discussed previously, that part, organ or tissue involved in disease process, it came under location. Then the kind of pain, sensation, functional and organic changes characterizing the morbid process, and conditions of aggravations and ameliorations, they came under these grand symptom. So under location, first came the part, organ or tissue involved in disease process. Then under sensation, it came the kind of pain, kind of sensation, as well as functional and organic changes characterizing the morbid process. And lastly, the all the aggravating and ameliorating factors which came under modality. So in this way, the grand symptom is completed by location, sensation and modality. And doctrine of complete symptom, or what is complete symptom? It is nothing but grand symptom plus concomitants. Means when in the symptom we get location, sensation, modality as well as concomitants, then it is called as a complete symptom. Then in his repertory, he first time introduced the gradation to the remedies. As I told, many drugs produce the same type of symptoms. When we go through materia medica, then we found that in many drugs we get the same type of symptom, but the frequency and intensity in appearance of that symptom, it was different. So this was the main basis, or this was the main thing according to which Dr. Boni Hussain, he get the idea of grading the medicines, and he graded the drugs. He indicated in terms of 5 rank by the use of different typography in his repertory, that is capital, bold, italic, Roman and Roman in parentheses. So the capital letters according to the importance of that symptom in that remedy, how frequently that symptom we found in that remedy, and with which intensity that symptom we found in that remedy. According to these things, Dr. Boni Hussain, he graded the remedies. In his repertory, he used the 5 grades, or he used 5 type of typography to write down the medicine. So how it was written, we will discuss in the